welcome to the TRT and Hormone Optimization YouTube channel. As a guest today, we have back here with us Dr. Jeffrey Ruterbusch. Welcome, Jeffrey.
Well, thanks so much for having me back, Stephen. Look very much forward to sharing some information with your viewers today.
Okay, great, thanks. We talked about nootropics before, but we had some specific questions about 5-HTP. So tell us more about that one, Jeffrey.
Consider subscribing, hit that notification bell, and you'll be on your way.
5-HTP stands for 5-hydroxytryptophan, which is a metabolite between tryptophan and serotonin. All right, now I'm going back a ways, but I was first introduced to 5-HTP in Japan 30 years ago, 1991. Because Japanese, they use a lot of supplements, vitamins, minerals, much more so than we do. But they've been using 5-HTP medicinally since the 1970s. So when I was there in 91, 92 practicing, and I first became aware of it and what they were using it for, I was amazed at what it can do. Now, there's a whole chapter in one of my naturopathic medical school books, a whole chapter dedicated to 5-HTP. Okay, and that tells you a lot. But anyhow, some people get concerned. I know one of your viewers was questioning the side effects of 5-HTP. But I want to say this: you have to get good products. All right. So there's the National Nutritional Foods Association. Again, National Nutritional Foods Association will put their label on supplements that they deem appropriately able to pass inspection. In other words, safety, like generally regarded as safe. So if you're going to get some 5-HTP, look for the NNFA label if you can. That means a lot for purity or impurity. Because the problem is, in the old days, we all heard of tryptophan being dangerous. Well, there was a bad batch of tryptophan some years ago, probably in the 90s. Just one bad batch, one. But it tainted the whole supplement industry of tryptophan because of the one bad batch. Now, I like 5-HTP because tryptophan, only about 3% of what we consume gets into the brain, crosses the blood-brain barrier. 5-HTP gets much, much more readily across the blood-brain barrier. So I like it because of that. Now, as I said, it goes from tryptophan to 5-HTP to serotonin. Further down the metabolic process, it can be converted into melatonin. Now, 5-HT is a significant antioxidant, powerful antioxidant. The Japanese use it significantly to treat depression. All right, depression. Now, let's talk about dosage a little bit. They recommend you start with 50 milligrams 3 times a day because the half-life is 2 to 3 hours. So it has to be therapeutic. It must be dosed 3 times a day. And so they recommend you start with 50 milligrams 3 times a day. And if you can tolerate it, then they suggest you ramp it up to 100 milligrams 3 times a day. Now, there is one mild side effect to it, and that's nauseousness, maybe some mild diarrhea. But there are enteric-coated caps and tablets that you can get that are much easier on the stomach, and that's also why they recommend you start low with 50 milligrams 3 times a day. And if you tolerate it, then you can bump it up to 100 milligrams 3 times a day. There's also sublingual preparations of 5-HTP, which are 3 to 4 times more effective than the oral preparations. So the side effect profile is very mild. It's usually just mild nausea. But I do want to mention that in studies, heads up studies, comparing 5-HTP to tricyclic antidepressants and SSRIs, selective serotonin reuptake inhibitors, they're equipotent. You don't hear about this much because Big Pharma doesn't want you to hear about a simple product, a food supplement that can be bought over the counter that is equipotent to treating depression as tricyclics and SSRIs. So I mentioned depression. That's what the Japanese were using it for. In the States, I have found it very beneficial also for anxiety, to quash carbohydrate cravings, so it can help with weight loss. Some people get the sweet tooth, they want carbohydrates. And so a good 5-HTP can quash your desire to want to consume sweets. I also found it helps a lot in my migraine and tension headache patients. And believe it or not, I found it works very well in my fibromyalgic patients. So that's an added plus, because I'm seeing more and more fibromyalgic patients on the medical cannabis side. Now, I mentioned the dose. Start low and go slow. There's been not one documented case of EMS, that's the eosinophilic myalgic syndrome. Remember I talked about the tryptophan? It caused EMS, but that was a tainted batch a long time ago. In the past almost 30 years now of use of 5-HTP products, pure ones, there's been not one tainted incident or an outcome of EMS. So it's very, very, very safe. All right. However, if you're going to be on it long term, like over 6 months, it's recommended in the naturopathic books that you do run some blood work once in a while, and just to make sure that you're not getting any type of elevated eosinophils, just to be safe. All right. So that's all I have to say about. And also, do not use it in pregnancy. So again, I don't use it in pregnancy. There's also some contraindications to using it with people with scleroderma. I don't know the biochemistry behind that, but just says don't use it in sclerodermic patients unless you're going to start low and go slow and run the blood work more often in patients with scleroderma to look for elevated eosinophils more frequently. But again, I just will stay away from it in scleroderma and pregnant patients. Now, lastly, I forgot. It also helps regulate your appetite. As I mentioned, people use it for weight loss. I found that the best dose for weight loss purposes is anywhere from 100 to 300 milligrams, of course, divided doses. But I sometimes have to bump that up to between 600 and 900 milligrams to get the effect, to the appetite suppressant effect. Yeah. I want to throw that in there. Have to titrate up to different effects for different people, for different outcomes you want to pursue. All right.
Okay. Thanks. Very interesting.